Hello. Hi. I'm Elle Wayara. I talk really fast. If I talk too fast, just tell me to slow down. So I am a Master of Public Health student. Am I giving feedback? Okay, I'm a Master of Public Health student, and my practicum projects were based on health and all policy strategies that we have learned and discussed in many previous theory courses. So my part-time practicum, it took place at the Ministry of Health. As you can see, the ministry has numerous amounts of branches and divisions. I completed my placement within healthy communities and age-friendly communities within the Healthy Living and Health Promotion branch. I had two supervisors, so Dean Murdoch is actually here today. He was the program manager for Healthy Communities and was my supervisor during the fall semester. He was promoted and left us, and then I transitioned to having Joanna Fox as my supervisor during the winter semester, and she is the lead for the age-friendly communities, and that was great. So my practicum was interesting in the fact that I completed it remotely. The Ministry of Health is based here, but I stayed in Vancouver and was able to do it at their Vancouver office. However, there were several opportunities for me to travel to Victoria for meetings and planning, which I was very fortunate to be a part of. In terms of tasks that I completed during my practicum, they included the tracking of healthy living strategic plans, which are partnership processes between local governments and health authority professionals that aim to create and facilitate healthier communities through coordinated planning. As well, I helped to create consolidated health reports every quarter, and these consisted of reporting from each health authority, which demonstrated the healthy community initiatives that had taken place in each region. As well, I had the opportunity to review a large amount of applications for the age-friendly programs grant process, and that encourages local governments to utilize funding to create and implement initiatives that lead to age-friendly designation. And then I got to attend so many meetings, all the meetings, at divisional branch team levels, and then also with our organizational partners, so the Union of British Columbia Municipalities, as well as BC Healthy Communities. So I got to see and talk to Loveleen a lot during the winter semester. So a big part of the second semester, because mine spanned from September to April, so the second semester was spent doing a rapid internal evaluation of healthy community planning at the municipal level. Unfortunately, the process lent itself to needing ethics, and it was too late to apply for that. So I didn't use it as my culminating report, but an overview of the evaluation was in me trying to attempt to create a before and after picture of health for communities. I selected 5 municipalities throughout BC, so one from each health authority, and conducted informal discussions with health authority leads, healthy community professionals, as well as community key stakeholders. After all these discussions had occurred, I developed a rapid report for my practicum supervisor with the general findings, and also used public domain documents and demographic information from Stats Canada. I gave a presentation to the Healthy Community Working Group, which is a provincial-wide entity that brings health community partnered stakeholders and health authority professionals together once a month. And I disseminated my findings there. So as Healthy Communities was the main focus of both programs, with age-friendly taking on a specific age demographic, I wanted to incorporate the local government aspect in any product that I developed for the Ministry of Health and link it to the Healthy Living strategic plans, which is a major part of the program. So health and all policies as a strategy has taken form in the HLSP process within British Columbia, which emphasizes coordinated health public policy processes. It's a lot of P's. Watching a National Collaborating Center for Determined Health webinar in November and doing follow-up research, I realized that there is a minimal amount of synthesized reviews related to local or municipal health and all policy strategies, and this may be because it's still a new concept that is being researched. So I chose then to create an annotated bibliography as my primary culminating project to demonstrate both the quantity of research that has been done around local health and all policy implementation, but also to denote the implications of these findings to future municipal coordinated healthy public policies that aim to improve population health. This could act as a resource for both the ministry and other public health professionals interested in this type of synthesized format. So UVic's database was the primary database that I utilized in scoping the literature for articles. So the workshops that we had during that gateway week at the beginning were very useful. I also totally forgot that we could use the librarians to help me with these search until today. So that's great. But I did it on my own. So in terms of methodology, I utilized the UVic library database. I used a variety of search terms and phrases such as local, municipal, city, town, and those were added to the fixed health and all policies phrase. After my search became saturated and redundant, my list was populated with about 38 articles. Reading through the articles of this list and utilizing my inclusion criteria, 25 articles ended up being annotated and included in the resource document. The general findings of this annotated bibliography consisted of, number one, the fact that so much work is coming out of Europe, specifically when it comes to Scandinavian countries, which is not surprising as Finland coined the term in 2006 and it has been using the strategy since the 70s. Number two, there are other interchangeable terms for health and all policies, such as intersectoral action for health and coordinated healthy public policy, which also have distinct differences and can have different implications for healthy public policy making. The third general finding is that there is not a lot of health and all policy research being done in Canada, especially at the local level. So major implications include how common language is key to facilitate any cross-sectoral government efforts. So much work can be stalled when differing terminology is used between sectors. Another implication is how mandates to formalize health and all policies are necessary for these processes to actually occur. And that is really exampled in Richmond, California, where they had an ordinance and that really proliferated their health and all policy programs. And the last is that many key stakeholders of healthy public policy lie outside of government, just like how health and well-being is maintained outside of the healthcare system. I also decided to do a health and all policy program evaluation proposal of the second culminating project, which would ultimately look at the HLSP process and its success as an indicator in healthy community planning measurement. So ideally, 10 participants would be included and consist of healthy community professionals who have had experience with the healthy living strategic process. In terms of methodology, plans for a qualitative process with a constructivist paradigm and grounded theory and participatory action approaches would be best actualized through conducting in-depth interviews, which would provide valuable data to be transcribed and coded. For data analysis, much health and all policy research has utilized the behavioral change wheel as an evaluation framework, and that looks at capabilities, opportunities, and motivations, and that would be used in this evaluation to provide consistency within the research. The evaluation will hopefully take 4 to 5 months, with the majority of time allotted to finding opportunities to conduct the interviews. So all the things I've learned. In terms of in my practicum, I learned a lot. I was very grateful for the spot that I was in and the people that I had contact with. Healthy communities and policies, planning and strategies to address population health issues are complex and need long-term commitment from city councils, key stakeholders, and civic society. Organizational partnerships are integral in supporting local governments in their healthy community planning. And healthy aging and age-friendly initiatives as a whole is a current focus that most municipalities have identified as a priority, which is really encouraging to see as the province's age demographic continues to shift and grow, which means solutions need to be created to help British Columbians age well in their communities. That's it. Just want to give a big shout out and thank you to Dean and Joanna and Nigel and Kathy and Betty and everybody.
Awesome. Thank you so much, Elle. And you'll see that Nigel has reemerged, so he's going to take over after we do this question section. Dean, did you want to ask Elle anything as a guest? Sorry to put you on the spot, but you're welcome to make a comment or ask a question.
Well, I let Elle know that I was really excited to see what she had to say about the work she was doing. As she mentioned, I only got to work with her for the first part of her term, so was disappointed to miss out. But what I wondered is, in terms of your findings for the development of healthy living strategic plans, did you find any shining examples? Are there communities out there of the 5 that you looked at where you think, hey, that's something that we ought to be trying in other parts of the province?
The main one, I'm trying to like say it without saying it because technically I don't have ethics to say it, but there were social community developers. And that's, I think, is really key in terms of connecting like health and well-being and having one designated person or 2 or 3 people who recognize the role of schools and activities and age-friendly and like coordinating that and being that resource to local governments. So that was a really encouraging thing to see, and I was very jealous that that city had that. And I was like, dang it, I would totally love to do that here in Vancouver. Maybe I can do that here in Vancouver, but yeah.
Other questions? I see a hand raised.
Good job, Elle.
Oh, thanks.
Also, good job of not having used the public health librarian. Good job. I want to make that really clear that
Like,
kudos to you, dude.
I like sat here being like, oh yeah.
You don't read the discussion forum. How dare you?
I think I did, and then in my head I was like, you know what? I can do this.
Sorry, none of these are questions. Okay, so I just had a question about why you chose those 5 particular communities, because they seemed really different, like Kitimat
Yes.
and Revelstoke and
Yeah.
like West Van. Like, why those?
So in terms of my selection criteria, the first one was having each of the communities that I was shortlisting be age-friendly designated. So not a lot of communities in BC are age-friendly designated and also have completed the Healthy Living Strategic Plan. So we wanted them to complete both of them. Okay. And then in terms of deciding which one in each health authority, we actually had discussions with health authority leads and asked them which community, based on like this list of 4, do you think would be the most beneficial for me to analyze? And they gave their input. So we went based on that as well. It's interesting because, I mean, comparing to Fino, which has a population of like 2,000, compared to West Vancouver, which is like it's oranges and apples. But it was really off of the lead of each health authority lead who like recommended a specific community. Yeah. Thanks.
And I'll do the room scan. Oh, Natalie's got a question.
Thank you, Elle.
Hi.
It's more of a reflective question for you. I think if I remember correctly, you're a nurse.
Yes.
And with young patients?
I'm a NICU nurse.
Okay,
Yeah.
that's what I thought.
Yeah.
So I'm just curious, it's just so interesting to work with neonatal intensive care with really young babies and their families, and then to choose to be kind of focusing on the other end of the lifespan. So I'm just kind of curious about how that was for you, sort of more of a personal reflection.
Yeah, it was really lovely. In the hospital, I mean, just like the population that I deal with, it's not like always sad, but for the most part, it's sadder outcomes. So it was nice to do almost like a 180 and focus in on what creates healthy communities, how policies that are developed and mandated and supported by like an array of stakeholders, how does that trickle down into prenatal care and education for families, and how possibly could we prevent, I don't know, but mitigate as many preterm births. And just to see like, the difference. I found it really interesting. I love like healthy built environment stuff, so it was really fun to work on in this setting, yeah.
Any other questions? Well, thank you so much, Elle. That was
Thank
really
you.
interesting. And
yeah. I didn't see my finger guns, but